Flexor hallucis longus tendon transfer utilizing Arthrex tenodesis screw technology to aid in chronic Achilles tendon arthropathy. An FHL transfer is performed to further solidify an Achilles repair construct. Begin by making a 5 to 7 centimeter longitudinal incision just medial to the Achilles tendon. Appropriate dissection is performed to locate the FHL tendon and muscle belly. Release the tendon as distal as possible and place a number 2 fiber wire traction stitch at the distal tip of the tendon. Measure the diameter of the tendon using the appropriate tenodesis driver handle. It is important to use a reamer that is 0.5 mm to 1 mm larger than the measured tendon diameter. Place a 2.4 mm tenodesis guide wire into the dorsal medial aspect of the calcaneus. Drill with the appropriate reamer to a depth of 25 mm. With the foot in slight plantar flexion, tension the FHL and mark the tendon at the insertion point of the bone tunnel. Then measure a point 25 mm distal to the insertion site and make a second mark. Cut any excess tendon and whip stitch appropriately using a number 2 fiber loop. Load the appropriate tenodesis screw onto the driver and shuttle a number 2 suture through the biotendinesis driver using the nitinol passing pin to make a suture loop at the distal tip of the screwdriver. Capture the tendon with the suture loop and insert the tendon and driver into the calcaneal tunnel with the foot in mild plantar flexion. Hold the thumb pad on the biotendinesis driver and turn the handle clockwise until the screw is fully seated and flush with the cortical bone. Cut the remaining sutures and the tendon transfer is complete.